Good evening to everyone, and thank you very much for joining. As George said, we will discuss about epidemic and pandemic preparedness. And I don't know if you were aware, but just yesterday, on 3rd of November, it was the Global One Health Day, which is actually an annual event dedicated to raise awareness on the interdependence of human, animals, and plants. So basically, the aim of my presentation today will be to raise your awareness, that we truly need to embrace the One Health approach or mindset as we actually build on our future resilience and as we are preparing our forthcoming, let's say, framework against pandemic and epidemics. And you might ask me, why the One Health approach? Basically because the One Health initiative is a more unifying, I would say, holistic approach, trying actually to, in a way, balance, but also prioritize the health of humans, animals, and the environment. So practically, the One Health recognizes the close linkage, the interdependence between these three sectors. And of course, I would say that it's not only a coordinated mechanism of response against epidemics and pandemics, but it's actually beyond that, if you think it. It's actually a way of redefining the foundation of societies, of redefining the role of humans in our interconnected environment. And basically, this concept of interconnected health is not new. I would say that it is a reflection or a forgotten wisdom of what indigenous people, like for example Maya or ancient Greek, applied for millennia. And it's actually what we say that the universe or nature is one, and all things are practically interconnected. And based on that, major organizations like the WHO, the World Organization for Animal Health, and the United Nations, trying to emphasize the urgent need of applying a more holistic approach and to foster, in a way, multi-sectoral efforts and collaborations, they have launched in 2022, as you can see, a joint plan of action with 6 priority pillars that we will discuss eventually in the following minutes. But first of all, I would like to go one step backwards and really understand what happened. So if you recall, in our everyday life, in science, in medicine, humans, the man, is the center of the universe. It's actually the measure of our reality. This is what we say, it's an anthropocentric approach or philosophy. But on the other hand, there is also other philosophies that we can apply, like a more cosmocentric approach, where actually the Earth is the measure of the reality, the center of the cosmos, and we, the human creatures, we are a part, I would say a very important part, of this interconnected ecosystem. But what happened in the reality is that humans actually were a bit disconnected. I would say sometimes disrespectful to nature, and all these uncontrolled human interventions that we have witnessed, especially during the 20th and 21st century, had an impact on nature, on this ecosystem. And we are currently discussing about multiple phenomena, from deforestation, climate change, urbanization, but all these has had actually as an ultimate sequence that we changed the global risk landscape when it comes to epidemics and pandemics, and we made it more easy pathogens and infectious agents actually to emerge or spread around the world. So in the reality, everything matters, including the population. So you can see here how things change, sorry. So before 10,000 years, human beings were only 1% of the total weight of vertebrate land animals, and 99% were wild animals. While currently, you see the changes. Actually, more than 30% are humans, more than 60% are livestock animals, and only 1% is attributed to wild animals. And what can we say here, for example, as lesson learned? Number one is that we have a significant biodiversity loss. And number two is that actually we are starting having what we say a human-animal interface conflict. So due to the density of the population, we need to share the same environment, the same water, the same land. So again, it's much more easy and it's much more probable for infectious agent to spill over and transfer from one species to another, and of course also to spread again around the world. So when we are talking about epidemics or pandemics, it's not actually just a random summary of events. It's actually the sequence that arise from an ecosystem change. And you see here on the slide that we have multiple drivers or enablers. Actually, we stratify them in emergence drivers, and we said many of them until now, and there are also amplification drivers. We said about increased mobility, urbanization, globalization, which actually makes what we say cross-border threats, health threats, visible and evident. And if you ask me also from my previous experience, one of the major, let's say, lessons learned from the COVID-19 pandemic were the following. Number one, that we didn't really realize that infectious agents were, are, and will always be constant companions of humanity. And if you go through the history of pandemics, we see this constant companion. Only for the last 15 years, we had 3 major outbreaks associated with the coronavirus's family. What is most important is to see the other part of the slide, which refers to an old review article published in 2007. And I just quote what the author wrote. The presence of a large reservoir of SARS-CoV-like viruses in horseshoe bats, together with the culture of eating exotic mammals in southern China, is a time bomb. So we had signals, we had alarming signs, but most probably we didn't pay attention that these changes in the human lifestyle and interventions might increase the risk of what we say zoonotic disease. And as you can see also in the following slides, currently almost 75% of the infectious diseases are zoonotic. The next step is to better understand or deepen our knowledge on these interconnections, and of course we have networks, and I would like, at least from my perspective, to tell you something more about the different levels of networking in our everyday life. So network number 1 or level 1 are the cellular or the microbial networks. And there is actually increasing evidence showing that the infectious agents do communicate with each other in order to be more adaptable, in order to be more virulent. And this is something that you can find under the terminology of quorum sensing. And of course, if you can see it outside, you can see it also here. We have the Vitruvian Man of Da Vinci that is now full of infectious agents. And if I ask you, do we have more human cells or microbial cells in and on our body? The answer is that microbial cells exceed the number of human cells in human beings. So there are also some, I would say, philosophical questions of what we are, about the community, the homeostasis or the balance and the communication or the network or the ecosystem within us. So this is number 1 network. Number 2 are the human networks. You are very well aware of them, and I would highly recommend you to read this book which was published by a professor from the United States, Nicholas Christakis. It's called Connected. And he actually managed to show in an evidence-based manner that we, are humans, we are influenced by our peers. And you know that very well in your everyday life. But please think about that. Our behavior, even as physicians, I don't know, our antibiotic prescribing behavior is directly influenced by our local networks. So we are in a way interconnected. And level number 3 are the global networks. So during the last century, especially due to the increased human mobility and the globalization, everything is interconnected, including pathogens. So please don't forget that we have to deal, when it comes to epidemic, with cross-border health threats. And as evidence of that, these are only 2 publications. The first one, which was published in 2016 in Lancet, which actually associate the worldwide travel routes and the emergence of antimicrobial resistance. And you see the lines, a chaos, but it's actually evident that it's always interconnected, the different areas. And the other study, which was published in Eurosurveillance, which shows actually the spread of a resistant fungal pathogen, specifically Candida auris, from Asia to Europe and vice versa, who knows. And since now we understand better a bit about the interconnection and the concept of interconnected health, of course we need to deepen also our knowledge about the drivers that we mentioned before. And of course there are obvious drivers. We discussed about climate change, agricultural farming, and everything related with environmental factors. But sometimes when it comes to epidemics and pandemics, we forget other dynamic or hidden drivers that do exist. And here is, for example, a very recently published report, actually 1 month ago, from an independent board who actually is trying to assess our pandemic preparedness. And as you can see here, in this 2024 report, we have the obvious drivers, but we have also social or financial or political drivers for epidemics and pandemics that you need to keep in mind. And I have just marked few of them, like, for example, social inequity or misinformation or trust. And what they did is, as you can see here on the slide, they created a heat map, and they stratified these actually drivers into 5 sectors, and then they show the level of impact. And when it's red, it's highly impacted drivers. And you see that red is, of course, global movement or agriculture and farming, but red color, which means high impactful drivers, are also trust, also misinformation. And they have to deal not only with the vulnerability to have epidemics, but also with our capacity to respond to these threats, epidemics or pandemics. Okay, and if you ask me, of course, okay, Zoe, what would be the next cause of the pandemic? Because definitely we will have epidemics and pandemics in the future. Of course, I don't know. Otherwise, I would be a Nobel Prize winner. But on the other hand, there has been substantial work and review towards this path. I mean, to identify pathogens that do have potential pandemic dynamics. So you see now a recently published actually report from WHO, and the expert group actually tried to, in a way, shortlist the pathogens that could eventually or potentially cause a pandemic. And you see, they tried to find some key criteria in order to proceed with this shortlisting. And these criteria is, of course, transmissibility, virulence, and the available vaccines and treatments. And based on that, from the, 1,400 pathogens, human pathogens, they finally, actually, as you can see, prioritized 34 pathogens from 16 families, mainly viruses. I hope you understand why. And the results of this, let's say, work was very similar or aligned with another work that I had actually the pleasure to participate, which came from a pan-European scientific consortium that tried, actually based on expert opinion to again shortlist and see which could be the pathogens of pandemic potential. And as you can see from the result of this study, influenza, including avian influenza, and the coronaviruses family are, let's say, top pathogens in these lists. And before closing this slide, I assume that you understand that this priority list is dynamic, since nature is pretty much dynamic, and we always include also disease X, which means a disease that we cannot predict currently, since nature is sometimes unpredictable. So in all lists, including the Vaccelerate or the WHO list, we have this disease X that you will see. And if I ask you, okay, we witnessed the previous years the COVID-19 pandemic, but do we have now, today, an ongoing pandemic? I think most of you would say no. Maybe some of you would say we have the Mpox, the monkeypox outbreak in Africa. But in the reality, we do have an ongoing pandemic currently, which is called the silent pandemic of antimicrobial resistance. And this is my second recommendation to see this video, which was actually coordinated by the Süddeutsche Zeitung. It's really a very nice film so that you understand the current magnitude of the problem. And since we are discussing about the current magnitude, you can see also this report from WHO 2023 about the recent major global health threats. And of course it's COVID, of course it's H1N1, the food safety hazards and the air pollution. But together with that, it's also the antimicrobial resistance health threat, associated, as you can see, with more than 5 million deaths. And of course with a huge financial loss that is estimated to be more than $100 trillion by 2050. And these actually are two landmark publications that were published both in Lancet in 2022. The first one, as you can see, is focused in Europe. The other one is focused in global data. So as you can see, AMR, only for 1 year, 2019, was associated in the European area with more than 500,000 deaths, and only with the bacterial part of AMR. While for the global data, we see that AMR death reached almost 1.3 million. And the predictions about the future is even worse. I'm sorry about that. But you can see that if we don't do anything now, then by 2050, the deaths attributed to AMR will exceed the deaths of cancer. And they are estimated again to be almost 10 million people per year globally. Of course, you can understand it's a major issue, and again with AMR we need to define and better understand the major drivers and mechanisms. This is another study published in Lancet in 2016 where they tried to find out also the relative contribution of these drivers to AMR. And what can you see on this slide? You can see that we have two major factors or enablers, human and animal antimicrobial misuse and overuse, both of them. And what happened, you can see also on this slide, you have the current antibiotic use, I would say overuse or misuse, in livestock in 2020. And you see the graph and the red color, which means high intensity of use. But what is in the red, let's say, frame is the most important part, the most important information for you. Actually, as you can see, almost 75% of the global antimicrobial use or sales, whatever, is associated with livestock and not with human use. Which means that if we are trying to structure, implement, design any antimicrobial stewardship program and we focus only on human sector, then we lost it. That's why we need to go back to the One Health approach. And this is the newest data that we have on hand about the estimated global pollution and contamination from the global antimicrobial overuse. I think that you can see the colors and you can see that we are at an alarming stage. This is another study that I find very interesting, published again in Lancet Journals 2023. What they did here is they tried to see the current landscape when it comes to AMR in animals and antibiotic use, and the same for humans. And what they did is actually that they found an association between these two interfaces. So increased antimicrobial usage in animals increases antimicrobial rates in humans, and vice versa. Again, another evidence that everything is interconnected. And if we would like to discuss a bit about local or national data, things are alarming too. So I had the pleasure to present to EFSA, which is the European Food and Safety Organization, and specifically to the risk assessment group, the data of Cyprus and the usage or the consumption of colistin, which is an antibiotic used especially for multi-drug resistant strains. And as you can see, among the different member states, currently Cyprus has the highest consumption of this antibiotic colistin, both in food-producing animals and in human sector. And now if we would like to assess, objectively assess, what is currently the global pandemic preparedness level. Do we need to improve? Are we fine, especially after the COVID-19 pandemic? Again, there is a report published in 2023 from the Global Preparedness Monitoring Board. And what you can see, what they did is actually, again, they had a heat map with 30 indicators, and they tried to assess at the global level, of course also in Europe, if there was declining capacity, if there were sustainable efforts after the COVID-19 pandemic to improve our preparedness plan and framework. And this is the summary of the results. So I will just read it because it's really very important to understand where we are. So this monitoring framework has revealed significant weaknesses or declining capacities in several critical areas of preparedness, including global coordination of research and development, efforts to address misinformation, prompt community engagement, participation of low and middle income countries in decision making, domestic and international financing of preparedness, independent monitoring, and meaningful involvement of all relevant actors. And where there are signs of improvement, they are fragile and in urgent need of reinforcement, which means that we have a lot of space for improvement when it comes to epidemic and preparedness framework. So if I ask you, what do we need to do? Actually, you are the students, you are the future of the society, you are the future of the scientific society. So actually, you have to ask yourselves, what can we do in order to improve our future epidemic and preparedness framework? Maybe one answer could be this report, which was published in 2013 from WHO, Global Research and Innovation for Health Emergencies, of course, with focus on epidemics and pandemics. And I would say that one of the most important slides of my presentation is this one, because what it depicts here is that definitely we do need global collaboration, but most importantly, we need continuous global collaboration even in the interpandemic period. So if we are just standing and waiting for the next major epidemic or pandemic to come, then we lost it. And it was evident also during the COVID-19 pandemic. What we need to do now is to focus during the interpandemic period to prioritize our research based on the pathogens that we mentioned before in order to improve the landscape, to improve our knowledge, to improve our available measures, treatment and vaccines during the interpandemic period. So it's very important for you to realize that we need to have a continuum when it comes to scientific collaboration and research. And of course, there are proposed actions by WHO, as you can see on the slide. with focus firstly in the interpandemic period. Number one is definitely that we need to improve our vaccines, our prevention tools for emerging and re-emerging infectious agents. Of course, as I told you about the human-animal interface, to better understand the epidemiological risk factors and what can we do in order to mitigate not only the emergence but also the transmission of all these emerging and re-emerging infectious agents to human beings. Of course, coordinated and standardized epidemiology and surveillance, which needs to be focused not only in humans, as you now understand based on the One Health approach, and of course to use our new tools that we have now on hand with artificial intelligence, machine learning, in order to further improve all the other sectors that I have mentioned. And again, during the pandemic, I think everybody knows what needs to be done, again, to improve the safety and efficacy of the existing vaccines during the pandemic. Clinical management and protocols, very, very important for the for the treatment of critical care. Infection control and prevention training is a must, okay, for all of us. And definitely to assess the effectiveness, the true effectiveness of measures, because you know most probably that there has been several discussions about the effectiveness of lockdowns, etc. So we need to prioritize those two. And since I have to present you also part of my scientific work during the previous, let's say, 4 to 5 years, I had truly the pleasure and honor to be part of some pan-European, let's say, networks. This is one of them, which is called Vaccelerate. It's actually embedded within a Horizon EC-funded project, and I'm proud because it was the first time in Europe that we tried to improve the capacity to build actually a pan-European scientific network focusing on vaccine clinical trials and research. There was nothing actually before that in Europe, and you can understand that we need these kind of scientific networks in order to complement the work of industry clinical trials and vaccines. So what we did when it comes to capacity mapping and building, we created first of all national coordinators, which were actually the liaison, the linkage between the national authorities and the central pan-European organizations. We built networks that are directly related with hospitals. So we have the clinical site network with more than 500 hospitals that are currently prepared to participate in multinational vaccine trials. And the most important, that actually was coordinated by Cyprus for whole Europe, is the, let's say, creation of the first volunteer registry in Europe. Actually, it fosters civil science. It's a registry open to all European citizens that are willing to participate in vaccine research. Okay? And currently, as you can see, it is active in 22 countries, translated into 22 countries, and we have more than 100,000 volunteers, including 4,000 children that are willing as active European citizens to participate in these efforts. And there are also other, let's say, networks that I'm participating to, for example, ECRED, which is, let's say, a pan-European alliance, again with research on infectious diseases, again with priority in pandemic preparedness, and we are trying actually to create what we call adaptive clinical trials. Since everything is dynamic, even clinical research needs to be adaptive to promptly, let's say, change the scientific protocol as things are constantly changing. And beyond that, currently there is an umbrella of these, let's say, scientific networks, which is called JAM. JAM means Joint Access Advisory Mechanism, with multiple scientific networks trying to join their forces and to communicate actually with the European Commission and the groups that are responsible in a way for the pandemic preparedness of Europe and of course also globally. So it's very, very important to understand, again, the power of networks, again, when it comes now to scientific networks. And last but not least, don't forget about training and education. We said in the previous slides about infection control and prevention. You, again, as the future scientific community, you need to apply in your everyday life infection control and prevention measures. It's very important to understand that. And currently the Medical School of UNIC is participating in another European project that is focusing on infectious diseases training based on a new reality, and of course with applying interactive methods in order to make it more appealing to you, the young generation. So stay tuned, because eventually during the year you will hear more about these training courses. But since I would like to close with a bit more, let's say, optimistic information, my lecture today, I would like to say that beyond all science, it's very important to understand that in order to have an efficient and coordinated mechanism against epidemics and pandemics, it is very important to focus on trust, inclusion, diversity, and equity. This will enable a prompt and active community engagement. And in order to achieve this, you can understand that we need experts from other, let's say, fields, like from social sciences or behavioral sciences, to understand at the local level what are the fears, what are the concerns, how can we approach better and more efficiently the community in order to be part of this effort of pandemic preparedness. So we need to reach out to the community, we need the community engagement, and we need the participation of the citizens in this kind of research. So it's very important to be inclusive. And we said it also earlier when we discussed about the hidden and dynamic drivers. Building trust is very, very important, because building trust is actually the foundation of a cohesive society that is needed in order to have efficient response mechanism to epidemic and pandemics. And these are some quotes of experts that are saying that trust is actually like the glue of a society, and we need that when we have to deal with a health crisis. Another very important closing remark is that if we need to build trust, then we need to enhance equity, which means that maximum equity equals maximum security. And we do know also from our previous experience with the COVID-19 pandemic that there has been several inequalities when it comes not only to vaccines, but also with other, let's say, products that should have been distributed earlier to specific areas. So don't forget, maximum equity equals maximum security. So what we need to do in the future, apart from applying One Health, is to be united, to join forces. And as it says here, pandemic preparedness cannot be a top-down exercise, okay? We truly need to protect the society. We truly need to protect each one of us and to make a shield. In order to make a protective shield, we need everyone to be a part of this puzzle. This is the meaning. And again, the power of unity. So if we have, in a way, some cracks in the society, don't forget, we said that infectious agents are very adaptive. They will find these tracks. And as a Trojan horse, they will intrude inside the society and they will cause the epidemics or the major pandemics. So we really have to build this, let's say, strong shield of the society against pandemic and epidemic risk. And this is actually my last slide, hopefully. So what we realized, of course, is that we have a changing environment. This is good, I'm not against it, but we have also a changing phase and risk of pandemics and epidemics. So in order to have a more, let's say, efficient, again, response mechanism against epidemics and pandemics, there are three, let's say, pillars that we need to keep in mind with everything that we do, including our everyday life. The first one is adaptation, is adapt. So most probably the next pandemic will be different from the last one. So responses must take into account the changing local, national, and global contexts. And preparedness, of course, and all kinds of frameworks must be designed with a focus on adaptability. This is number one that you need to keep in mind. Number two is about protection. So holistic systems approaches is to protect, first of all, the vulnerables, but the whole community. And the whole community is, as we said in the previous slides, the whole ecosystem. So we need to realize what protection means. And most importantly, we need to keep in mind the linkage, as we said at the beginning of the presentation, this interconnection. So the risks attached to increased planetary connectivity need to be mitigated by better supported intersectoral efforts inducing a comprehensive, actually, One Health approach. So with that, I'm closing with what I started, that it's very, very important, you, the future, in your everyday life, to apply this kind of One Health and to remember, as Pythagoras said, that the universe is one and all things, everything that we do is interconnected with others. So thank you.